Today we have with us Mr. Dyren Glasberg, who is the Executive Director of the Medical History Museum in Alabama, USA. Mr. Glasberg, welcome.
Welcome, it's nice to meet with you.
I think we are going to have a very interesting conversation, and let us begin by asking you what is Alabama's relation to the early medical history?
Right. So, at our museum, our story begins with the Mississippian people of this area who were here 10,000 years before the first European explorers. And of course, they had their own civilization and their own medicinal practices. Specifically, they had an enormous knowledge of medicinal plants, some of which they passed on, they introduced to the Europeans who came here. And so to represent that history, we have a medicinal garden at our museum and talk about some of their herbal practices. Then, of course, we move on to the French. Alabama was not part of the original 13 British colonies that became part of the French colony of New Louisiana. And when the French founded Mobile, a few years later in 1711, they built the first hospital in this area. Many years before the first hospitals appeared in the British colonies. Then after Alabama becomes a state in 1821, Mobile, which is where we are, that's in the southwest corner of Alabama, bordering the Gulf Coast. So Mobile becomes a very important port city, and for many years it becomes the center of medical education and healthcare in our area. Mobile held the first public health board, as well as the state's first traditional medical school, and that was built in 1859 as the Medical College of Alabama. So we have a very rich history covering, hundreds of years of medical history that's well represented in our collection.
Throughout history, people had to confront viruses. They had to face viruses and disease, of course.
Right. Germs is kind of a collective term that we apply to bacteria, viruses, protozoa, all of these microorganisms that we need a microscope to see. And of course, people were well aware of the existence of microorganisms for centuries, but it was not until the mid-19th century that some scientists in the West began putting the pieces together between the relationship between germs and human disease. One of the key figures was Louis Pasteur, a French microbiologist who was doing some fermentation experiments in the 1850s, trying to figure out why alcoholic beverages fermented. And in the process of these researches, he determined that it was the same bacteria that was causing fermentation that also caused a lot of human illness. And from there, germ theory began to develop very gradually for the rest of the century. New vaccines were developed, and it really transformed the whole practice of medicine.
A rich history behind, indeed. So, to more medical issues, if we could say that, what's behind the germ history, and what exactly is the difference between bacteria and viruses? I know that it may be known to many, but could you give us more on that?
You wanted me to give you some examples of, that's right, differences between bacteria and viruses. So, the two main germs that we're concerned about from a human perspective are bacteria and viruses. They are both, bacteria are single-celled organisms that can live in extreme environments. They can live on their own, and they're very adaptable. They're not always harmful. Some are harmful to us, and others help us with our digestive system, with our immune system, with various other aspects of our health. Whereas viruses are very much smaller than the smallest of bacteria. Even though they contain DNA or RNA, they are not really considered living organisms because they need a host to survive. They can't live on their own. They can't survive on their own, rather. And they are always harmful. So whenever you get a virus, it's extremely dangerous and needs to be taken care of as soon as possible. Some of the most devastating diseases in human history have been caused by viruses, also bacteria, but primarily viruses. The bubonic plague was actually a bacterial infection that was spread by fleas. Of course, I'm sure many of your viewers and listeners have heard of that. The Black Plague was also called, killed 50 million people in the 14th century, including up to about 60% of the entire population.
Now, going back to Alabama's medical history, could you give us some important names, some important personalities?
The world's first vaccine was developed for smallpox in 1796 by Edward Jenner. Yellow fever, I mentioned that one before, spreads through mosquitoes. It was in particular a very severe problem in our area and in other tropical areas. It still exists today, but it is much more contained in much of the world than it used to be. Influenza, the flu, of course, there are many strains of the flu, and we, in this country, we try to get our flu shot every year. One particular deadly strain of the flu is H1N1, which has caused many different epidemics, including a famous one, the pandemic of 1918, also known as the Spanish flu, even though it didn't originate in Spain. But that one killed between 20 and 50 million people worldwide. And there's been a lot of renewed interest in that virus because of its similarity to COVID-19. So those are just a few of the well-known ones.
We live and learn, actually, so as we move on, things change and we need to keep up with that. So I think, yeah, exactly. And for our final question, for those who are interested, how can they contact you or find you?
Right. So we have a website. It's www.mobilemedicalmuseum.org. We're also on Facebook and Instagram, and we're very active on social media. We post pictures and articles about medical history several times a week. We have virtual programs. You can find our contact information on our website. You can also send us a message through Facebook if you would like. But we definitely encourage you to contact us if you're planning a visit, or if you would like us to come to you and design a a virtual program that fits your needs and serves you from wherever you are in the world.
This sounds amazing and very impressive for those who want but they cannot have a hands-on experience or visit Alabama and the Medical History Museum. Well, Mr. Glasberg, I would like to thank you for being here with us today. Thank you for the conversation.
Thank you, Maria, and I appreciate your questions, and I hope to see some of your audience at our museum in the future. Okay, take care.